Hey everybody, welcome to another episode of I
Wonder
Wednesdays. I'm Dr. Hausman.
I'm Dr. Gersberger.
And today we're going to be talking about diabetes and your eye. How often should I have my eyes checked if I have diabetes, Dr. Gersberger?
At least once a year. And I will say our friends that are medical doctors have been much better about getting and letting their patients know that they need to come in once a year and get their eyes looked at. One of the most important things that we do in a diabetic exam is we dilate your pupils and we take a really thorough look around the peripheral retina, the very edges of your vision. This is a place in your body that has some of the smallest blood vessels in the body that can be easily seen. And the ways that we can look at them, we actually can see them carrying blood through those vessels, and we can see damage to those vessels like microvascular anomalies, which are little tiny bubbles or bulges on the edge of that vessel that are weak spots. We can see bleeding and hemorrhages inside the eye. And then we report that back to your primary care doctor. I always try and get a report out the same week that we see the patient back to the primary care doctor that says what I'm seeing inside the eye. And then it also has a recommended A1C level for that patient. And it's not the same for everybody.
Yeah, the reason that happens, like you get bleeding inside the eye when you have diabetes and your blood sugar is out of control. Basically with diabetes, your blood sugar gets too high. When your blood sugar is too high, the blood can't carry as much oxygen, and the eye needs a lot of oxygen. And so if it's not getting enough oxygen, it's going to send out signals to the body that says, I need more oxygen. The body's response is to make new blood vessel growth that's not supposed to be there, and it bleeds and leaks inside the eye, and it causes a lot of problems inside the eye. So
yeah, my description of that is kind of road construction. So they're going to build a little like bypass around the area that they're working on, and that's great. You know, it does the job for a short period of time. But that isn't designed to handle the full traffic. The new blood vessels that are formed in your eye are kind of like those temporary roads, but we're putting the full blood flow through those, and they're not designed to hold up. They're not as strong as the blood vessels that are in there already, so they tend to be a lot leakier and cause problems. It's your body's response. It's your body's natural way of dealing with an issue that it thinks it can fix. But it's not a permanent fix, and those new blood vessels can cause all kinds of problems, from bubbles of blood under the retina to little mini strokes because there's a blockage. They can cause all kinds of other issues as well, like high eye pressure. So they can cause glaucoma, actually.
Just all different kinds of ways that you could lose your vision. So it's very important to have your eyes checked at least once a year, sometimes more frequently depending upon what's going on inside the eye. But at the very minimum, if you have diabetes, you need to have your eyes checked once a year.
Yeah, if anything's out of the ordinary, we'll usually bring you back every 6 months or every 3 months, depending on what's going on. Also, diabetes will cause your prescription to change.
That's exactly right.
So a lot of times we're on the front lines, we find a patient, all of a sudden, between last year and this year, there's been a 4-step change in their prescription, which is really unusual in a short period of time. And one of the things that can cause that is diabetes. When that blood sugar is very high, your prescription tends to be more nearsighted. The lens inside the eye actually swells because of osmotic pressure, which is just a really fancy word of saying there's too much sugar, there's too many solutes in that liquid, and so the lens itself swells up.
Yeah. I was going to say something else, but I forgot.
We do like to see you, if you are a newly diagnosed diabetic, get on your medication and get your blood sugar down, and we'll get really consistent results about 3 months after you start your medication. So sometimes we'll get a new diabetic and they're like, I've only been on medication for a week. If I make you glasses on that day, it's probably not going to be the same prescription when you come back 2.5 months later. Even when you pick up your glasses, they might be wrong. So that's another way that we find patients that are diabetic is we'll find a prescription 2 weeks later when the glasses are done. We give them to the patient and they're like, I can't see out of these. And so it's that's not my favorite way of finding out somebody's diabetic. But they don't have any actual damage yet. And so you can't see the changes to the blood vessels until that's a little bit more of a chronic condition.
Right. And sometimes, that's what I was going to say, sometimes people don't know they're diabetic until they come to have their eyes examined. And sometimes we will, be going through a regular eye exam and look inside the eye and find out, hey, there's bleeding back here. What's your blood sugar? And they're like, what are you talking about, my blood sugar? Well, you got diabetes. And so,
yeah,
it's...
we mentioned the A1C earlier. An A1C is a protein, hemoglobin A1C, that is made. Literally every single blood cell in your body, when it's made, it has this protein, and it has a certain level of that protein. So the A1C is a really good measure. It is a 3-month average of where your blood sugar has been. So every blood cell that's made in your entire body is completely recycled about every 90 days. And when that happens and every new blood cell is made, then we can take a sample of blood, spin it down, and we can get an average of what that protein is in that sample of blood cells. And if it's a big enough sample of blood cells, we have at least one blood cell that's made every day for the last 90 days. And so it gives us a much better way of testing that blood sugar and knowing kind of where you're setting on that. A1Cs, we recommend typically below 7. 6.5 or below is pretty much normal. If you get to 7 to 8, your risk of damage goes up. If you get to 8 or 9, that risk of damage is about 30%, so 3 people out of 10. If you get above a 9, it's about 50-50. About half of my patients that are over a 9 will have damage to their blood vessels.
Say, I've got a favor to ask. Down there, there's a like button. Can you click it for us?
Yeah. YouTube, Facebook,
Instagram. Yeah.
Also, fun fact, diabetes is the #1 cause of blindness in the United States.
Yeah.
There you go.
Hey, thanks for watching. We'll see you next time.